that everyone is a potential victim.
Yeah, well.
But the good news is that everyone is a potential solution. Sensitize the masses to sanitize. Keep a social distance and quarantine. Stop! The coronavirus is sweeping over mankind. Everybody must be alert. It's a global pandemic we can never take for granted.
Yo, stop that, DJ. Stop that. Yo, to the world. Yo, welcome. What was that little dainty tune I was playing? That's the Corona Virus Alert by Bobby Wine and the All Stars Collective coming out of Uganda. And as the name suggests, it is a cautionary tale about COVID-19. Which is what we're talking about today. We're talking about coronavirus in Africa, looking at a few select spaces, looking at some of the major controversies that have arisen, and see what going on. I'm your host, as always, Dr. Shingima Vima. And while I'm talking about Bobby Wine, I also want to just shout him out because he's one of the most prominent young political activists, not just in Uganda, but on the continent as well. As a whole, he's an artist, but he's also been running for public office. And currently, if I'm correct about this, he's actually currently in prison by at the hands of the Museveni administration. For protesting corruption and oppression and these other sort of things. So, Africa is the continent of youth, and better must come, really. So we stand with you, Bobby, and we stand with all the other activists right now who are imprisoned for speaking their mind. I can think of Hopo Chingono in Zimbabwe right now, or he just recently got out, but he's been arrested a couple of times again for exposing corruption in the Zimbabwean government and so forth. So we stand with everybody who speaks truth to power, and we admire your courage, and we dream of a better Africa with you on the forefront. So like I said, where have I been? Well, it's been a few weeks since I last uploaded a video. And sometimes I'm just taking some self-care time, and also sometimes I'm doing the research. Right, I'd rather upload, if it came to it, once a month as opposed to uploading weekly, but uploading shoddily researched works. So I'm glad to be back. And of course, like I said, we're talking about COVID today, which is a contemporary issue. So the information that exists, COVID really hit hard in 2020, right? So a lot of the dynamics we are observing are evolving right now. They are not set in stone. So when I'm talking about these things, we know very well that things are being tried and are failing, things are being tried and some are working and so forth. And the issues are constantly changing. So take that as you will. This is a moment in time sort of presentation, and if there's enough demand, if there's enough interest in this video, maybe in a month or two I will do another video focusing on a few other sites, other countries in Africa, and maybe just an update on where some of the conversations we introduced today are. In any case, let me go ahead and share my screen and we can get to talking about this. All right, I'm loving it. Okay, good. So if it's all the same with you, we are cooking with gas. I will see you at the end. All right, bravo. So like I said, COVID-19, the respiratory airborne disease, breaks out in late 2019, starts to spread in January and so forth. I don't think it hits Africa until at least February, at least the earliest recorded things, at least end of February, if not early March. So it's been around for the better part of 2020, but So that's what we're talking about today, and we'll just have a conversation about this. Like I said, a lot of the works that are out are constantly evolving. There hasn't been a lot of peer-reviewed work published, as one would expect, in such a short time. So we'll just be introducing different topics. So let's take a look. Where do we stand? So this is some of the more recent data I got on this that showcases how many confirmed cases there are. I think I heard today that this is from November 8th, so a couple of weeks ago, but I just heard today that we hit 2 million on the continent, which is a lot, but by proportion, also remember that Africa is well in excess of 1 billion people. So 2 million people with confirmed cases. 45,000 dead, probably closer to 50,000 now. But however, 1.6 million who have fully recovered. So that's if we are looking at the chart here with the countries listed. Then you see high on that list are countries like South Africa, Egypt, Tunisia, Nigeria, Algeria as the ones with the most cases. But it's also very important to recognize when you're looking at that list that there's significant jumps in cases between the top countries. So the way to look at it is it's going from left to right, left to right, left to right, left to right. Okay. So it goes South Africa, then to Morocco. So the jump between South Africa and Morocco is pretty significant, right? From 737,000 to 256,000. Then Egypt is also in the 100,000. Then Ethiopia by now is crossed over into the 100,000. So it's going like that. But the one trend that you immediately see, there are two important trends that I want to point out to here. The first one being, where do you see all the countries that have at least on the map here, that have the highest infection rates? So the bigger the circle, the that just shows the intensity of the numbers, right, and of the rate of infection. So one of the things you notice right away is that a lot of the bigger circles are in the coastal areas. So a lot in North Africa here, Egypt, Libya, Morocco, right, prominently, Tunisia, Algeria. Then you also have South Africa, of course, which we said was the main one. We have big ones in Kenya, Somalia. And then we have them in Nigeria, Cameroon, and Ghana as well. So what gives, right? Well, there's two things to think about. First of all, coastal areas are more open, people are likely to travel to those places. There are a lot of people land in these places before they go somewhere else, and so forth, right? In North Africa, we're talking about proximity to Europe and Asia as well, right? So South Africa is a huge hub. Nigeria is a huge hub of commerce. So people are always traveling back and forth. That's the first reason. The second reason is also something else to think about is that coastal areas in Africa, if I was to include a map here of the countries that are wealthier African countries, it would overlap somewhat with this area, with the map here. That's to say, countries like South Africa, Egypt, Nigeria are high up on that list. Then you have countries like Ghana and Morocco, who are sort of in the second tier. So there's also a lot of economic activity, a lot of people who travel overseas and so forth within those spaces, right, who would then come back and possibly are carrying. So those are some of the hypotheses as to why these things are concentrated here, are concentrated in coastal areas. So one of the things that before I go forward, one of the things that when coronavirus first broke, and the conversations were starting to rise around it, end of February, early March, as an African living in the USA, and I wasn't alone in this, I was very worried, not for my sake, because it's it's just me. I was very worried for the motherland because I felt that, especially as I started to see countries like Italy, which was one of the first ones that I remember really struggling with this disease and being overwhelmed, their hospitals being overwhelmed and so forth. And I was thinking, wow, if Italian hospitals can be overwhelmed, I know, for example, I know other countries such as South Africa do pretty well with healthcare, but I know, for example, Zimbabwe, where I'm from, is has pretty terrible healthcare for the most part, at least public, right? There's some very good private spaces where some of the more upper middle class people can go to, but a lot of the public hospitals are the stuff of shame, really. And when we talk about protests and things like that, those are some of the areas that really that people really point to as being a failure of the government in recent times. So I was very worried about that, the facilities, but also when you think about places like Mbare in Zimbabwe, when you think about people like Soweto in South Africa, and you think about this sort of communities where people are, it is virtually impossible to socially distance if that's where the tonic lay, right? So very worried that if COVID was to sweep through Soweto, for example, or if it was to sweep through Matapi in Bade, for example, like the homes are not even 6 feet apart. The homes are not 6 feet apart, let alone the fact that they're tiny homes that are packed to the brim with people, right? So, and if I had visuals, yeah, maybe I'll put links to some of the other spaces. So if you're not familiar with them, you can see what I'm talking about, sort of shanty towns. So I was very worried about that. So I'm saying all this to say it informs my conversations going forward and some of the things we've since found in the past 9 months. So the first major debate that I noticed, the first major debate that was worth talking about was when two French doctors who were on the forefront of working on a vaccine were on TV, and one of them had gone, if I can be provocative, shouldn't we be doing this study in Africa where there are no masks, no treatments, no resuscitation? A bit like as it is done elsewhere for some studies on AIDS and prostitutes. We try things because we know they are highly exposed and that they do not protect themselves. So other than that sort of characterization of prostitutes, the thing garnered so much backlash. For several reasons, right? So much backlash. You had prominent soccer players, sports stars like Didier Drogba and Samuel Eto'o. We had African politicians speaking up on this. I think in might be in Cote d'Ivoire, where a testing center was burnt. Just public sentiment all across the continent, really like saying, like, lambasting these comments, and that is not without good reason, right? When you look at it on the surface, it may look like, oh, these Africans are tripping, right? Or they're being too sensitive, but you have to put it within larger context. So the hashtag that came up was hashtag Africans are not lab rats, and that is the exact same quote that Didier Drogba here starts and says, do not take African people as human guinea pigs. Now, again, when you take it in isolation, it may seem like, was that an overreaction? But what you have to know is there is a long, long historical precedence of medical experimentation of black and brown bodies. You can talk about the Tuskegee experiment in the US of A. You can talk about the studies in, I want to say Venezuela or Guatemala, and I do apologize for the disambiguation between those two, but it was a Latin American country where a few years ago it also came out that large-scale testing had been done on local people as an experiment. We can look at the fact that there's different spaces in Africa where that's happening right now, okay, or that has happened in the past. We can look at the fact that the likes of different, and the book Medical Apartheid by, I believe it's Harriet Washington, details a lot of these things in American history, right down to uh, P.T. Barnum, who is revered here in the U.S. as an entertainer, who used to do these weird experiments on black people, and sort of use them to showcase, um, to as sideshows in his circus empire. We can talk about Henrietta Lacks and this. So I'm saying all this to say that, and this manifests in prominent ways to this day in a space like Black America. And I keep talking about Black America, even though we're talking about Africa, but those plights are never as separated as we think. To this day, there's a level of distrust between the Black community and the medical profession that is a far cry from, say, with the white community and the medical profession, and it's rooted in these histories. And now to bring it full circle, was this a test that came out a few years ago where medical students were being asked, and a ridiculous number of them, I'm talking about way over 50%, felt that Black people felt pain differently to white people, were more resistant to pain than white people. Well, think about that. That is not the layman's opinion. These are medical students. And if they feel like that, that means that there's a huge disconnect between them and the Black community. I don't want to go off on a tangent with that. Well, it's sort of a tangent, but I'm saying all this to say, historically, at least in modern history, the Africans and people of African descent have had good reason to worry, to be skeptical about being used in medical experiments. So another reason why the backlash grew is at the time and up to now, right? We said 2 million people affected, around 50,000 deaths. Those numbers are less than a fifth of where the US is right now. The US is like a quarter of the population. At the time when this conversation was happening, this was in early April, Africa, there had been very few African cases recorded at the time. In the meantime, this disease had run havoc in Italy and other parts of Europe. It had run havoc, it was starting to run havoc in the USA. Well, how counterintuitive and patronizing is it that you would want the trial to be done in this place where there are hardly any cases, even though you can tell that these other places are struggling? And eventually the doctors apologized to that, for that. And progress has been made around vaccines. And I want to just get this out there real quick, that the idea is, because I know some dogmatic folks will say, well, we don't want the vaccine at all as Africans. No, that is not the case. The idea is about agency, right? First of all, for African doctors and researchers to be involved in this process. And secondly, for us not to be experimented upon, eventually, of course, the vaccine needs to make it around the world, Africa included. Otherwise, that would also be a genocide of a different case if it was knowingly kept away from Africa. But the idea is that we are not lab rats, right? So that's the first debate that came about it. The second debate is, remember those reasons I told you earlier, where even I myself was afraid that, if this was to start sweeping through the continent, we may be done for. A lot of people felt that way. However, as time passed, we saw that Africa endured the virus in ways that are much better than other spaces. But in fact, we'll get to that real quick. So keep that in mind, right? That as time is passing, Africa is handling this, all right? So yeah, this is some of the headlines that broke at the time. Like I said, this is in April. These are two of Africa's greatest soccer players. The debate rages on who was better. I'm Team Eto'o myself, but I'll catch that. But that's besides the point. Yes, the headline where another headline for this talking about the hashtag Africans are not lab rats. So that's a little bit about that. Another early crisis that broke out surrounding this was a racism row in China, and this was very fascinating to me. So as the virus began to spread and started to take shape, we saw increased incidents of xenophobia and anti-Black racism especially against African people in China, right? Where Africans who were coming back maybe from an extended Christmas vacation or so forth were blamed for, quote unquote, the second wave of COVID-19 cases in the country, which is counterintuitive, right? That the disease itself had broken out of from China. Then also these folks who were coming back, if you're coming from Africa, which at the point you had very few cases, how could that be the reason for the spike, right? But as a result, they were evicted, repeatedly tested, just even after they've been cleaned, banned from restaurants, publicly shunned. And I think a famous case was one of the things that went viral was McDonald's, I believe, in China, which had this sign that explicitly said, Black people not allowed in here, and that really broke that's the one that broke the internet and really garnered a lot of responses. The U.S. responded to this. The African Union, different African leaders spoke up against this. Really just came out swinging about it. Just really protesting, and felt violated. Felt that the whole conversation really was patronizing and a violation of rights. With I know the Nigerian government officials, for example, demanding meetings with the Chinese officials in the country to sort of get this squared away. The U.S. was very vocal about it, even warning African Americans not to travel to Guangzhou. Now, with the U.S., it's it's a little less benevolent than it appears. The U.S. is, of course, in a battle for global supremacy with China. So anytime they can take a stab, it's not because the U.S. all of a sudden loves Africans more than it ever did before, but it's just a matter of gaining some moral higher ground, which China clapped back, talking about how you telling us we need to treat Black people better. You need to treat treat Black people better over there. So, it's Africa often falls into this idea of as something of collateral in this global power struggle. China, which has been making inroads in Africa in a very different way to the way the colonialists did, where they were more paternalistic. China is kind of claiming this brotherhood, right? This idea of brotherhood, that we are coming to work with Africa as brothers. And they claim that the brotherhood with Africa is uncompromised. And the people that are being evicted and so forth are mainly undocumented immigrants, so we can't keep track of them. And they say foreigners just need clearance to be out and about. So this is some of the conversations, right? And those very well may be the official positions, but as we know, that official positions do not often translate to being the public positions, and the public positions really did seem like Black people were being evicted and were not being protected by the law and were being banned from restaurants and so forth. So that was a very important race role. This comes out in March and April, and not much has been spoken about it since then, but it sort of set the pace for and was reminiscent of other ways in which Africa has been treated prior to this. All right, I'll skip over this video for Copyrights Act, but I'll put the link as well. This is a video that I share with my students, for example, if we're in class, but I won't play a YouTube video on YouTube because that's some crazy metaphysical stuff, right? But I will put it in the comments here, and it's a 19-minute or so video that goes further into why Africans are were being targeted in China at the time. So remember that preface I gave earlier about how Africa had seemed to have weathered the storm much better than expected. Not just better than expected, but also even better than other countries that have seemingly have more resources and wherewithal than the continent. Well, that sparked a different conversation, which is far more recent. I think this is in October. Sorry about that. In which the idea of poverty actually saving Africa was taunted. And this headline broke out in the BBC, where, for a long time people have been asking how Africa has been able to do so well in all this. Then this headline came out: coronavirus in Africa, could poverty explain the mystery of the low death rate? And it's such a ridiculous premise. But this is what the writer, Andrew Harding, the African correspondent, wrote. And I quote: crowded townships, poor hygiene, the impossibility of social distancing in communities, while large families often share a single room. For months, health experts have been warning that living conditions in poor urban communities across Africa are likely to contribute to a rapid spread of coronavirus. But what if the opposite is also true? What if those same crowded conditions also offer a possible solution to the mystery that has been perplexing experts of the continent for months? What if, and this is putting it rather crudely, poverty proves to be the best defense against COVID-19? What an absurd premise. What an absurd premise, right? And he came out, Andrew Harding, and he didn't apologize, and he said, we're just putting out theories here. First of all, as a journalist, you are not a scientist, and now is not the time to play scientist like that, right? When you put out these crazy theories like that. So that's the first thing. That's the first. That's one of the red flags, anyway. But the other is it also plays right into the narrative of, if you've seen my other videos, I don't know if I've spoken about this, where, or you might just have heard about this, that folks would rather attribute the pyramids to having been built by the aliens as opposed to attributing them to African ingenuity. Same thing with the Great Zimbabwe, where the idea was that civilizations from as far as Indonesia came to South Central Africa and built the Great Zimbabwe in the 13th century and left no other trace there except those buildings. And that's the idea of African agency, that nothing excellent can come out of Africa, right? And even this response, the fact that maybe it's because they're poor. So a lot of people came out swinging about that, right? Including a lot of government officials, including this Nigerian senator who was talking about how, then why are the poor in the West dying? Which is a valid question, that when you look at the Western world, where a lot of these cases have been detected, the poorer people are the ones dying by the numbers. If poverty saved them, wouldn't it save them as well? This other person going by Mazi Ezeoke on Twitter also said, "Stop with the insults. You predicted that we will all die because of a lack of health facilities. Now, to your disappointment, we survived. And now you say our low death rate is because of poverty," right? So a lot of offense here. And Catherine DeAndrea also on Twitter said, "Is this for real?" It seems that they always find a way to cover African news in a negative light, even if it's good news. So this was the backlash, right? That came out of it. But it still begs the question: why is Africa doing so well? And Andrew Harding's asinine theories aside, there are some reasons that have been put up here. Let's look at a few reasons here why this was an article that was written, and I really enjoyed this one, that spoke about things that have worked. and I can't remember who wrote some of the articles that spoke about this, but this was a more scientific space, and I'll put all my sources in the description as well. So what was some of the things that happened? A lot of quick reactions, right? There was a lot of quick reactions the moment that this news broke, because it broke in other places a little bit earlier. Um, the countries on the continent got to shutting down borders early. They got to enforcing lockdowns early and so forth. So just that quick reaction when compared to other places where in the Western world, right, where or even in some parts of Asia, where people waited to see where this was going for a few weeks before they decided to start shutting down things. Africa shut down things pretty early on. The other thing is also there's been a lot of public support for these initiatives. I think there is a great fall in line, great recognition of the potential threat of all this. So a lot of people came out, and there's a lot less polarization about, oh, you're infringing on our rights and all these things. A lot of people also, when authorities speak, not necessarily the government, but when other people or authorities on these things speak, a lot of people are listening. So the initiatives got a lot of public support, where a lot of people got very invested in them, where people are volunteering to do testing and so forth, things like that. Another reason why Africa has enjoyed this better than other places is because Africa is very, very young, with an average age of 19 years, right? So a lot of the people who have died in the Western world um, are also older people, 80 and up, which in other places that's a pretty big population, but in Africa I believe it's like 3% of the population. So a lot of the people are younger, so they can, even the ones who are catching it, can bounce back. Uh, so the youth of the continent as a whole is also playing a large part in this. The climate, while the science hasn't been that conclusive here, there is the idea that the idea is that in more tropical regions and so forth, the virus doesn't spread quite as fast as it does in more colder communities. So that's something else that's been happening. Then finally, the other thing that has really been important has been good community health systems, where because of the communal nature of many of African societies, and because of such diseases that have existed in the past that have run havoc in recent times, such as HIV, AIDS, Ebola, and so forth, there's good community health systems that are in existence. So where people are not necessarily qualified nurses and so forth, but these health workers who work within these communities are, and there's some of the initiatives that are pictured in this space where health workers go door to door to check on these things. Local clinics are a dime a dozen and so forth. So these are some of the things that have worked well. And let's unpack. We'll look at maybe half a dozen countries and just talk about what some of the major issues that have come out surrounding them and their response to COVID and where they are at right now. Like I said, we'll look at a few. I've tried to break them up by either by region, so that it's pretty representative. But again, it's half a dozen of them, maybe 10 tops, so we can get a vibe for this and see what some of the issues that are coming out are. Cool. All right. So let's get started with the country that leads the continent with cases right now. South Africa is a pretty sizable population as well. So those are things that we have to take into account. And like I said earlier, it is a hive of, I think it is second only to Nigeria in terms of the economy, but with a third of the population and so forth, some of these things are to be expected. But 757,000 cases is pretty high, although it's been 20,000 deaths, which is a pretty, God bless the dead, but it's a pretty low number by proportion to the number of cases, with more than 700,000 people having recovered. So the early responses were actually widely praised, where they went into strict lockdown at a point when only 5 people had died. In South Africa, like I'm saying, South Africa is a big, it's a part of the BRICS nations together with Russia, India, China. and Brazil. I say this to say it's a major player, or it is a significant player in global commerce. So for them to shut down that early was they took a hit, and it was pretty admirable. Then early on, they put in place drive-through testing centers, which helped a lot. Another thing that where South Africa thrived, that other countries, the US included, seemed to struggle with a little bit, was in clear messaging. In South Africa, the health minister, right, who's the government official, so the Secretary of Health or so forth, was even the president would defer to the health minister to talk about what is going on here. So you didn't have these sort of quacks or the president saying one thing while the health minister saying another thing. When it came to where the issue was from a health perspective, that was all channeled. It was clearly messaged through the health minister, right? So that was key. And the president and other people would pass restrictions and so forth accordingly after what the health minister had spoken of and recommended. So that was that's been a big thing. And like I said, because of the response has been praised, and South Africa is one of the bigger countries, one of the more cosmopolitan countries on the Africa. They became an example for the continent, such that my own Zimbabwe, you could follow, at least in the early days, you could follow their play-by-play by watching what South Africa did, and you would know that in a few days' time, the Zimbabwean government was going to announce a very similar initiative. And you can tell here, this is the graph where infections peaked around July, and they were been on a downward slope. A slight upsurge lately, but so far so good. It's gone pretty well for South Africa. There's been a couple of criticisms, though. The first one being that the lockdown was very heavy-handed, right? It was enforced in a heavy-handed way, which upsets some sensibilities of freedom and things like that. In fact, 70,000 troops were deployed onto the streets, such as this fella here, which is the biggest army deployment since the end of apartheid in 1994. So that's very seismic, right? That's very, very important. And some people had felt that, and the South African Defense Forces that was enforcing this, employed some of those tactics, including a brother who was killed, when alcohol had been banned. He was killed for having a beer in the back. And that became a rallying cry as well, especially in the aftermath of the George Floyd murder in the USA. Parallels were drawn between that as there were solidarity protests around the world. So that's another thing. The other thing that has happened is this another controversy that has rose up has been the housing crisis. Like I said earlier, so many parts of South Africa are already, South Africa is the most, according to World Bank stats, is the most unequal country in the world. So the rich are very rich, but they also live across the road or across the river from these slums. And those slums are, a lot of people were being kicked off there who are unofficial, who are quote unquote squatters, were being kicked off this land as COVID broke because, of those worries that, they'll facilitate the spread of COVID much faster because they live all together like that. But what they did is where are they going to go? So that became a huge crisis. And many of them actually just moved across and claimed other territory, other places where they could find land and set up informal shacks, their tins and plastics, and set up other homes there, right? Immediately creating another community. I was reading recently that one of the communities is actually called COVID, right? A little sort of wink reference to say, like, this is a community that has grown out of COVID. Hundreds and thousands of people living in spaces like that. COVID. Another one is called Sanitizer, and another one is called 19. So it's a lot of this tongue-in-cheek names that they're giving their communities to as a poke at the government for not being able to provide decent housing for the citizens of South Africa. Indeed. So that's what's happening with South Africa right now. We'll keep watch to see if this upsurge continues, or and if they can keep their numbers low. Everybody sort of watches South Africa with that. So In West Africa, two countries that have very similar graphs, if you will. This is Ghana here. Had really, it really peaked around June. Then sort of upsurged again early, in August. Then it's been on the downward path, a little upsurge as well, which is something that's happening around the world lately. The reason why that's happening around the world is I think many people are starting, there's a second wave of coronavirus coming in, and many communities were starting to slacken, if you will, on some of those early restrictions. So that's Ghana. Another one of the continent's more powerful nations, 50,000 cases, but around 300 deaths. Ghana's response has been praised highly. It has been number one in testing per million on the continent, which is fantastic. Then one of the things that I found that I thought was interesting was the use of zip lines and drones to deliver test kits to different communities. So such ingenuity on the continent is pretty cool to see, and that's really helped keep their numbers low. Senegal is a bigger country than Ghana, I believe, in population as well, physically for sure, territorially for sure, but I think the population as well is bigger. But they have similar number of deaths, even though they have way less cases. But the cases are among the lowest per capita in the world, one of the lowest cases per capita in the world. And it was actually ranked second out of 36 governments for its global COVID-19 response index. So this is not 36 other African countries, just 36 countries in the world, and also highest for communication. They really make use of that community-centered healthcare system I spoke about earlier. So it really worked for them. Then they're also developing these $1 rapid test kits you can take home that are in the mode of a pregnancy test. So these are many ways in which Ghana and Senegal are being innovative in pushing back against the disease, against the virus, which has kept their numbers to less than 1,000 fatalities, to less than 500 really at this point, right? Which is pretty cool and encouraging to see. And this is the zip line, and then the drones dropping off the testing kits in Ghana. And this is what the prototype for the home test for COVID looks like. And again, they're $1. So soon there'll be, they've made about 10 million of them, and they look forward to spreading them around, not just Senegal, but the rest of the continent as well. These are the places looking at North and West Africa. I thought this was pretty interesting. Nigeria is always interesting, because it's the most populous country on the continent, and it's doing all right for a country that size as far as deaths. To have 1,200 deaths, again, it's never a good day when people die, let alone 1,000 of them. But for a country of around 200 million to have 1,200 deaths is very admirable. And one of the people who actually died early on was the president's chief of staff, very early on. I think this was in April. So that maybe added a sense of urgency to the affairs. So Nigeria is doing well. You can tell the graph here. Peaks around early July, like everything else, has been on a downward slope lately, a slight upsurge. But again, we'll see where that goes. But one of the things that Nigeria is dealing with prominently right now is this COVID-inspired recession. It's kind of going through a recession where, let's see here, its gross domestic product has gone down for the second consecutive quarter, according to official data. So this is Africa's biggest economy. Is in recession for the first time since 2016, right? And the IMF, International Monetary Fund, has forecast a 5.4% drop in Nigeria's GDP this year, and so forth. So this is pretty seismic, right? For Nigeria to be going through only its second recession in four quick years, when it hadn't been through that since the 1990s. So that's something that will be worth watching about Nigeria. Earlier on, there were also debates that have since been dispelled, but early on, a lot of the people, lower middle class people and below, were not really concerned because they thought that it was a rich person disease, and that rich poor schism is very pronounced in Nigeria. But now that cases have spread across the board, that is not something that is being spoken about as much anymore, and attention really seems to be being paid to this idea of how to survive this recession. Algeria, North Africa, touching on North Africa a little bit. Algeria, I added Algeria specifically because even though it's done all right with 2,000 deaths from 70,000 cases, there has been a huge upsurge lately. The most significant upsurge so far, as you can tell here, it is actually at its highest now than it was at its peak before in July, which is unlike anything else we are looking at here. And actually, the president was one of the people who's actually gotten the virus as well. He's still recovering. He hasn't recovered fully yet. He's not out of the woods entirely yet, but he's still recovering. But yeah, that's been very concerning, really. And this upsurge in has led to new restrictions, which include among them a curfew will be imposed overnight across most of the country. Sports halls, recreation and leisure areas, beaches, youth and cultural centers will be shut for 15 days. Businesses are required to close from 3 p.m., with cafes and restaurants limited to takeaway. The government has also reiterated that there was a ban on large public gatherings, saying they help spread the virus. Yeah, of course, we know that. So it's very interesting, and Algeria will be a space to keep watching, because, wow, right? Like, that upsurge seems to have come out of nowhere. And they're not the only ones who relaxed restrictions. So why them in particular compared to the other ones? I don't have the answers for that, but we'll keep watch. Moving on to East Africa to chat a little bit. South Africa's actually Kenya. Scratch what I said about Algeria. Kenya is actually been on the rise consistently since end of September here. So this is incredible. Their numbers are not too crazy. 77,000 cases with 1,380 deaths. And early on, they had been able to enjoy, because Kenya is one of those places that enjoys very good relationship with the donor community and the Western world. And they'd received a significant stimulus package that was backed by the EU and the World Health Organization, up to like $5 billion. So I don't know what has happened since then, where it's all gone wrong, right? And a lot of people feel that they are on their own. The argument is that they've been feeling that they are on their own in this fight, because they feel that the money that is being brought in by the donors is going to take care of certain groups of people, the middle class, the political elites, and so forth. But a lot of the people feel that they are own. So, for example, Kenyans watched last week as President Uhuru Kenyatta inaugurated a new hospital with COVID-19 facilities for United Nations staffers and the entire diplomatic community. And yet some Kenyans have complained of being turned away from care in public hospitals. So that's a very interesting dynamic of how well they did early on. Early on, at their peak in July, they were far better than most of the countries in the world. But now they've been on the rise. And I think it's a combination of one, loosening restrictions too quickly, as well as that disproportionate distribution of resources that have come in. That's a little bit about Kenya. Another, much like South Africa, the conversations about law and order have also come in, where enforcement early on was also very heavy-handed, even though they slagged on it after they made those gains in September. So by September, for example, they had hit zero, close to zero in terms of new cases. Then all of a sudden, it's shot up pretty significantly. Another thing, more funny anecdote. Well, I'll touch on that on the next slide for sure. Rwanda, on the other hand, has done very, very well. That's our star child. But Rwanda, as a whole, if you look at it post the genocide in 1994, has been on the up and up. In the economy is doing well. The social cultural landscape, the country itself is very, very pretty. If you're a fan of football like I am and a fan of Arsenal, you notice that even Arsenal has the Visit Rwanda thing on their sleeves right now. So they've been doing very well under the leadership of Paul Kagame. It's not without its problems, of course, but it's doing well. Such that since March, there's been 2,000 cases that have broken into the country. By contrast, a state like Ohio in the U.S., which is a similarly sized, is at 12,000. Is at 1,200 new cases a day. So that's crazy, right? And so much has worked well for Kenya. I mean for Rwanda. Sorry, let me get back to Kenya a little bit because I felt like I didn't unpack that real quick, and I'll get to Rwanda shortly. I promise that. So think about this. The country has over 70,000 cases, confirmed cases, which is far less than other nations. But it has seen, this is Kenya, it has seen a 34% rise. And the health minister says this has been a very bad week for us. And he's talking about the recent week where there's been this upshoot in these cases. And one activist goes as far as to say, we are on autopilot, we are on our own. The government is not interested in containing COVID-19. Their key interest is in changing the constitution through a referendum to entrench power. This is from political activist Boniface Mwangi and so forth. So look at these numbers. So in September, the numbers were 38,000. September, that's 2 months ago. At the beginning of November, it was at 53,000. And now it's at 77,000. So that's 25,000 just this month alone of the 77,000 total, and more than twice as much as in September. So this is jarring. This is very jarring to see. But yes, that's about that. So back to Rwanda. I was talking about how Rwanda has been doing very well, relatively since the genocide in 1994, being able to build a vibrant socio-economic, political economy, and so forth under the leadership of Paul Kagame, which is not without its controversies, of course, but it's been doing well. And those are the numbers of the cases. And one of the things that they've done very well is this idea of pool testing, what they call pool testing. What they did, and I quote here from some of the officials, from the director of the Rwanda Biomedical Center, who says, so whenever someone is driving a vehicle, bicycle, motorcycle, or even walking, everyone is asked if you wish to get tested. So what they've done is they got a lot of college students and other community health workers to populate the streets and be asking people, the way people may canvass in other communities, ask them if they want to be tested. And these health officials are in personal protective equipment, and they administer the tests. And even though it's voluntary to be tested, some people say refusal is frowned upon, which, that's where that blurry line about you're being voluntold to do something. Then what they do is, this is the idea of pool testing. The idea is, you get swabbed, then you fill out your contact details, then all these samples are sent to a lab, right? In Kigali, for example, which is the capital, but also there's 6 others around the country. And after that's done, then they'll do this thing called pool testing, where material from 20 to 25 nasal swabs are all put into one vial and run through a machine. This allows them to test far more samples at once. If they get a positive result, then all the swabs that went into that initial vial are tested individually to pinpoint the person who's infected. So that's very effective, right? That's something that's worked. The other thing that's been a blessing and a curse is for Rwanda, as well as other places, is that they already had, because of infectious diseases running rampant on the continent, and in Rwanda in this case, they already had some of the infrastructure set up in ways that other countries may not have had them, right? So, for example, here, the director who I was talking about earlier says that the main machines we are using for COVID testing are the HIV machines that were already there. We are using the same structure, same people, same infrastructure, and lab diagnostics, but applying it to COVID testing. So that's really good. That's one of the things where this curse we've had of things like HIV/AIDS in the past has proved handy in this moment, right? And another official was described who was observing this. This guy's an international observer. He was saying, so talking about some of the things that Rwanda has done well. One is they responded really early. They put some of the most stringent lockdowns in place compared to every other African country. In fact, we've been monitoring physical distancing data across the continent, and Rwanda fares, I think, second. Their physical distance is second most across Africa, with South Africa being number one. But like I said, with South Africa, because of its inequalities, when there's great physical distance, there's a lot of it. But but that's undone by the fact that some of the people really live bumper to bumper in these slums. So indeed. So like I said, Rwanda uses this community health workers, police, college students to work as contract tracers. So that's something that's really helped. And you can tell right here in the map that it peaked in maybe end of August, early September, but it's been on the downward slope for a long time. And slight shoot up like we said in other places. But yeah, the other thing to think about too is this idea of how the lockdown was very strict, and that's something else that Rwanda has been previously criticized for, not just with COVID, but just that the Paul Kagame administration is very, very heavy-handed, a benevolent dictatorship, if you will. But perhaps that's a conversation for another day. So this is these are a couple images that I thought I would share. This guy here on the top, swagged out as ever. It was a funny story that came out earlier in which this governor, he's a governor of in Nairobi. He's a governor in Nairobi, where he was sending out care packages to different people, and his name is Mike Sonko. Yeah, he announced plans to include a small bottle of Hennessy in food packs being distributed to the city's poor families amid the coronavirus pandemic. He put Henny, he put a bottle of Henny. Yeah, because, anything can happen. I mean, it's not really like something that you need, but I thought it would be a nice touch to add that into the packages that he was sending to the poor. Now, the government, but this is what his reasoning was. Now, if it was just a nice little touch to say like, yo, you guys enjoy when you're logged indoors, this, whatever. But the funnier thing was, this is what he thought. He said, the governor believes that the alcohol in Henny can kill the coronavirus, clearly misunderstanding what medical experts were saying, that alcohol used in hand sanitizers and other products that contain 60 to 70% alcohol can kill the virus on skin, not drinking alcohol. If anything, drinking alcohol could increase your risk in COVID. But I don't know if that's, I think it was just trying to be slick or playing dumb by saying that. I think he just wanted to sneak in the bottles of Henny. Because if it was really just about killing um, the virus, there are far cheaper alcohols that you could have included. That you could have put in bottles of 5 o'clock, if you're really trying to just do that, But that's my man, Mike Sonko. Vote for him next election if he's up again. Then this other image down here is from Rwanda, where among the many innovations they have is they're using these robots here to help with administering tests and delivering different information as well. So that's another thing that has made Rwanda such a marvel to see. So indeed. Finally, I would be remiss if I didn't talk about Zimbabwe, which is my homeland. So far, 9,000 cases dictated and 265 deaths. And Zimbabwe, and I'm just speaking very candidly now. The first death that was recognized in Zimbabwe was the death of a 30-year-old broadcaster, Zororo Makamba, who had just returned from New York, and he died on March 23rd. And Zororo Makamba and I, I'm gonna say, we were acquainted or anything like that, because he's a couple years younger than me. But we are only separated by 1 degree. There's only 1 degree of separation on a couple of fronts. First of all, many of my friends are friends with him, especially the ones who are maybe a couple years younger. We went to rival schools in high school. So I was 2 or 3 years older than him. So a lot of the people who were a couple years behind me in my high school are very familiar with Zororo. That's the first thing. The second thing is also he went to Michigan State University in the U.S., and I got to the Michigan State University. I'd gone to other universities prior to that, but I got there 2 years after he left. So we're tied in sharing those spaces, albeit indirectly. And also, he would run a TV show in the mode of a John Oliver type commentary, maybe a little more serious than some, less humorous, if you will, than John Oliver, but still to the same effect, called State of the Nation. And for the 2 or so years that he ran it, it was my go-to video when people around the world would ask me what was happening in Zimbabwe. He did a great job, and he's left such a hole in the social political commentary and the media world in Zimbabwe right now. So he died on March 23rd. But because he was such a big name, or at least a growing name, and also, so he's a big name in my generation, but also for other people who are not of that generation, his dad was a pretty high profile figure in the past. So other people will be like, oh yeah, that's James Makamba's son, and that puts them on game as far as this stuff. Then for us, it's like, wow, that's Zororo. And it was such a painful moment, but it was one that also really alerted people to the dangers of the virus. And immediately after that, the country went into lockdown, and it's been that way since March. It's only really started to open up. One of the conversations that came up in Zimbabwe that I was paying attention to, which is, I'm sure the dynamics are very similar across the continent, but in Zimbabwe it's very pronounced because the economy, maybe like 80 to 85% of the people work in the informal economy. So the difference then is, one, when you work in an informal economy, you can't really work from home. That's one. And two, you are not salaried, right? Your existence depends on you being out in the streets on the regular. If you're selling clothes on the street, if you're selling fruits and veggies on the street, if you are an artisanal miner and all these sort of things. So that conversation really affected people, like, what are we gonna do now if I can't be in the streets and the marketplace selling these things? So that's something that really hurt people, during all this time. And people have had to innovate more, like neighborhood markets have been popping up as well. So there's that. Another thing that's happened recently is finally that schools are opened earlier in November, I believe, or end of October. The schools were opened in mass. But one of the big things that happened is that at a boarding school, I think it's called John Tarlac boarding school, it was just opened, and 100 students who tested positive for the virus within the first couple of weeks, and it had to be shut down. It had to be shut down quickly. So it's a boarding school. So boarding schools are a little bit trickier. So it'll be interesting to observe whether that trend happens with other schools as well, whether that school was an outlier, which it wouldn't have a reason to be an outlier. So we'll be watching how things are going in Zimbabwe. Madagascar, finally, I'll talk about Madagascar. One, because as an island nation, it is often marginalized when it comes to these conversations. 17,000 cases, 250 deaths, not too bad. But the reason why Madagascar really made it into the news is early on in March or April, the president came out, and the president of Madagascar came out and endorsed this local concoction, this cocktail, as a potential tonic. It's known as COVID Organics, right? It's made of different roots and other things like that. And they had spoken about, endorsed it as something that could prove to be the antidote to COVID. And people got really excited about that. It's the president who's endorsing it. But many people, and even other African governments, famously, the Tanzanian president jumps up and says, like, yo, send that my way so we can start to use it at our people as well. And a lot of this was based around this narrative of the same thing we spoke about earlier, about this skepticism around European medicine, right, around Western medicine, which we spoke about at the beginning of the presentation, that people were like, you know what, if there's going to be a solution for Africa, it's going to come out of Africa, and they meant to sell it to everybody, but and the president had endorsed it. But however, other people, even within Madagascar itself, other health officials were not entirely sold on this, right? They were urging school children to use it and so forth as a tonic, but many people in the country itself were skeptical, right? We're very skeptical, of this, of sort of pushing this thing as a cure. Now, this is not to say it's not without its merits. It's probably been very good with other respiratory conditions and other sort of colds and the flu and so forth. So it works in relieving some of the symptoms, but it's also not a tonic, right? And as later on, by August, there was a surge, as we can see here. There was a surge in cases. That's when everybody started to jump up. So like, oh my God, we may have jumped the gun with this. This tonic doesn't seem to be working at all, and so forth. But in any case, due to lockdowns as well, and Madagascar is an island, and islands usually fare better with things like lockdowns. The numbers, there's been no new cases lately, so it's doing very well. And we'll wait to see whether the tonic that they created, COVID Organics, has anything to do with that, or if this is just a trend based on things like lockdowns and so forth. Finally, it's also worth noting here that Madagascar, many people in the Western world know Madagascar as the country, the island from the cartoon movie with the lemurs, King Julian, I like to move it, and so forth. But a lot of their wildlife is also facing a crisis due to COVID, not because they are sick or anything like that, but because as more and more people losing their jobs, and less tourists are making it to the island, people are having to cut down trees for fuel and for land and these other things. People who don't usually do that. So when they do that, the trees are the natural home of the lemurs. So as their homes are being destroyed on the daily, their population is constantly on the decline, and there's reports that lemur population may never make a comeback from COVID. So these are some of the other quote unquote communities that are also being affected by COVID. All right. So yeah, this is a picture of the president here to the right is the picture of the president of the Madagascar president drinking some of those COVID organics, and you see he has other people doing the same thing in his government, and the lady behind him looks less than impressed by the showmanship of it all. It will be interesting to see if the COVID organics, even though it is not the actual remedy, it will be interesting to see if it ends up featuring in part of the when the vaccine, if some of the ingredients end up being informing the vaccine itself or the cure itself. But right now, people have been very skeptical about it. And finally, this is the man, Zororo Makamba, whose name actually means rest. So with that, I will end the presentation here. And like his name, I'll say Zorora Imurugare, comrade. You, for a brief moment, you were here and you made us believe in the future of the country, and we'll keep running with the torch you passed on, sir. And that's all I have. I won't finish this presentation with the key takeaways page like I usually do, just because this is a more contemporary conversation. But let me know what you think in the comments. Help me fill in some of the gaps to the questions we asked earlier, as well as stay healthy, man. I know we're going into this second wave across the world. Keep masked up, keep socially distanced, drink lots of water, just stay healthy. If you can get your hands on COVID organics, do that. Don't expect it to be the answer to COVID, but it looks like it's got some, it will help you at least stay fit somewhat. And so forth. And so with that, I am done here. I will see you guys in a sooner than later. Be sure to like, share, and subscribe to this channel if you enjoyed it. Yours truly, Dr. Sengi Mafima. I'm fresh out.